Welcome to week 3. Over the past 2 weeks, we've built a foundation in systems thinking, frameworks for assessment, and methods for gathering data. Now we take a crucial step. We shift our focus from data to people. Human-centered design, or HCD, is not just another methodology. It's a fundamentally different way of approaching the work we do. It starts with a simple but radical premise. The people we're trying to help know things we don't, and if we design with them rather than for them, our interventions will be more effective and more sustainable. By the end of this lesson, you'll accomplish 3 objectives. First, explain the 4 phases of the double diamond design process. This is the core framework of HCD, and understanding it will structure our work this week. Second, compare human-centered design with community-based participatory research. Both approaches value community engagement, but they emphasize different things. Understanding the differences helps you apply each appropriately. And third, identify opportunities to integrate HCD into your traditional planning approaches. HCD isn't meant to replace what you already know, it's meant to enhance it. Let's start with the problem we're trying to solve. Public health has traditionally operated on an expert model. We're the professionals. We studied the science, we know what causes disease and what prevents it, so we design interventions based on our professional knowledge and deliver them to communities. Communities are recipients of our expertise, but here's the issue. This model has limited understanding of lived experience. We know the science of nutrition, but do we understand what it's like to be a single parent working 2 jobs, trying to feed kids something healthy when the only store nearby is a convenience store and you have 20 minutes between shifts? That lived experience matters for intervention design. Without it, we create programs that look good on paper but fail in practice. Human-centered design is a creative approach to problem solving that starts with empathy. Before we design solutions, we deeply understand the people we're designing for. What are their lives like? What matters to them? What have they tried before? What works and what doesn't? HCD is iterative. Instead of spending years developing a perfect intervention before testing it, we develop ideas quickly, test them with real users, learn from failures, and refine. This approach originated in product design, companies trying to create products people actually want to use, but it's now applied across sectors, including healthcare and public health. The insight is universal. If you design for people rather than at them, you get better outcomes. The double diamond is the core framework of HCD. Imagine 2 diamonds side by side. The first diamond has 2 phases. Discover. You explore the problem space broadly. You're not yet trying to solve anything, you're trying to understand. You talk to people, you observe, you immerse yourself in their world. Then define. You converge on the specific problem to address. From everything you learned, what's the real challenge? What needs to change? The second diamond also has 2 phases. Develop. You generate and test potential solutions. You brainstorm, you prototype, you try things quickly and see what works. Then deliver. You implement and refine the chosen solution. The key insight is the shape. You diverge, exploring broadly, then converge, focusing narrowly, twice. First for understanding the problem, then for developing the solution. The double diamond relies on 2 modes of thinking. Divergent thinking opens up possibilities. You're not judging yet, you're generating. How many different perspectives can we gather? How many different solutions can we imagine? The more the better. Convergent thinking narrows down. Now you're deciding. From all these perspectives, what's most important? From all these ideas, which should we pursue? Both are essential, and they happen in sequence. A common mistake is converging too quickly. You talk to 2 people and think you understand. You brainstorm 3 ideas and pick one. This truncates the process. True HCD requires discipline to stay in divergent mode long enough to really explore before you decide. Let's compare HCD with something you may already know, community-based participatory research, or CBPR. There are important similarities. Both value community engagement and participation. Neither treats communities as passive recipients. Both recognize that community members have expertise and knowledge that professionals lack. Lived experience counts. Both aim for interventions that fit community contexts rather than generic solutions imposed from outside, and both critique top-down, expert-driven approaches to public health. If you're drawn to CBPR, you'll find much to appreciate in HCD. they share philosophical foundations. But there are differences too. CBPR emphasizes power sharing and genuine research partnership. Community members are co-investigators, not just informants. The power dynamics are explicitly addressed. HCD emphasizes usability and user experience. It's less explicitly political. The goal is creating something people will actually use and value. CBPR's primary lens is equity and justice. It asks who benefits, who decides, who has power. HCD's primary lens is desirability and feasibility. It asks, will people want this? Will it work in their lives? Neither is better or worse. They're complementary. In public health, we might use CBPR principles to ensure equitable partnership and HCD methods to design usable interventions. They can work together. You don't have to choose between HCD and traditional planning. HCD enhances existing frameworks. Think of it as adding new tools to your toolkit. Here's how integration might work. In your needs assessment, add empathy research. Go beyond surveys to deep conversations. Observe people in their daily lives. Understand experience, not just statistics. In intervention design, prototype and test before full implementation. Build a rough version. Try it with a few people. Learn what works and what doesn't before scaling up. Throughout the process, build in iteration. Plan for multiple rounds of testing and refinement. Don't assume your first design is final. HCD adds depth to proceed, enriches intervention mapping, makes logic models more grounded in reality. It's additive, not competitive. HCD is particularly valuable in certain situations, when existing interventions aren't working. If programs keep failing, HCD helps you understand why from the user's perspective. What barrier are you missing? What assumption is wrong? When serving populations you don't deeply understand. If there's a gap between your lived experience and that of the people you're serving, HCD bridges that gap through empathy research. When designing new programs or services, starting from scratch is an opportunity to get it right from the beginning by designing with users, not for them, and when user engagement is essential for success. Some interventions only work if people actively participate. HCD helps ensure that participation feels worthwhile from the user's perspective. Let's summarize our key takeaways. The expert model limits our understanding of lived experience, which is essential for designing effective interventions. Human-centered design starts with empathy, deeply understanding the people we're designing for, and uses iterative design to test and refine solutions. The double diamond process alternates between divergent thinking, exploring broadly, and convergent thinking, focusing narrowly through 4 phases: discover, define, develop, deliver. HCD and CBPR are complementary approaches. CBPR emphasizes power and equity. HCD emphasizes usability and experience. Together, they're powerful, and HCD enhances traditional planning frameworks. It adds depth and user grounding to methods you already use. In our next lesson, we'll learn empathy mapping, a specific tool for capturing and organizing what we learn about users. Thank you.